Hi, it's Jessica DaMassa with HIMSS TV, and joining me right now I have Bettina Experton. She is the CEO of Humetrix, and what they've got that is really cool is they have the first CMS-approved mobile application for Blue Button. So talk to me about this, and remind everybody first what Blue Button does.
So Blue Button is a fundamental, critical public health initiative to give Americans who benefit from federal programs such as Medicare, veterans, and people in the military covered by TRICARE access to their medical information.
Right.
So that they have it at all times, for instance, on a mobile device like your iBlue Button application does, to share critical information when they receive care, to avoid medical errors, to avoid redundant care.
And so you guys have developed an app that lets people access this data on their phone, right?
Correct.
Okay.
So in fact, back in 2012 at Health 2.0, on the main stage we received one of our big awards from HHS, which was to come with a common sense but complex technology, which was to transform Medicare claim financial information into a medical record on your phone by decoding that financial information and translating into English, and organizing the information so it becomes meaningful with the list of medication you are on, the medical history, what tests you got, so they are not repeated, etc. And that was back in 2012. That was iBlue Button 1.0.
What point are we on now?
8.0.
8.0. Oh my goodness.
And
it's Blue Button 2.0 at this point, right?
It's Blue Button 2.0 because CMS and its leadership with Seema Verma came to that common sense approach that if you put that critical information into patient-consumer, for them to share wherever they receive care, interoperability could play in the hands of the citizen, the patient, that providers should not be tasked to do those very IT complex processes to gather information, transfer it, and they don't have the time, and meaningful use was a burden on them. So now with Blue Button 2.0, CMS is going live at a large population scale for 53 million Americans covered by Medicare to say now we have tools which use that Blue Button 2.0 program to access your information so you're not at a loss and you can avoid those medical errors when you go to the emergency room, when you go from one specialist to the next. And that's especially true for people who are over the age of 65 covered by Medicare.
So have you launched the app at this point?
So iBlue Button is available today to download. That has been the case since 2012, but the 8.0 version, which we, in fact, we first unveiled it at the White House because HHS and the White House organized a Blue Button conference on August 13, and we were demonstrating that technology then. Here at Health 2.0, we did it again. It will be publicly released in October.
So coming up very soon.
Yes.
Okay, and so as far as getting the CMS approval for it, talk to me a little bit about that process. How did that go?
So what CMS did is that they put up an API for developers like Humetrix to have their application chosen by those beneficiaries to get that Medicare claim information and turn into something useful.
Right.
But you have to abide by technical rule to make use of that API, and also make sure that your application is secure, respects individual privacy, the HIPAA law, and so forth. And CMS goes through this stringent approval process to check on all those technical security privacy points.
I wanted to ask you, so as you launch this, and as you know, I mean, your market is tremendous for it. I mean, 53 million Americans, you said, right? I mean, so how do you know, I mean, are you doing anything to help patients be more prepared to manage their own data? Like, are we really ready for this responsibility?
I think especially when you reach the age of 65, or when you are a family caregiver of an elderly mom or dad like me, I have an 89-year-old mom, you are on call all the time and should be prepared at all times to answer that critical question. What medication you take when you take on average, when you're on Medicare, 5 or more medication every single day. The likelihood for you to recall all those medications by the correct name, who prescribes them, for what, when, and so forth, is unlikely. No one can do that, and especially not under stress when you go to the doctor or you're in the emergency room.
Sure.
So those individuals themselves or their family caregiver are looking for tools like that. And I think, so the tech world has delivered those tools. They've been approved like ours, by CMS. Now CMS has a duty, I would say, from a public health perspective, to let that public, their beneficiaries, their constituents, know about those life-saving tools. This is about as important as getting vaccinated against the flu. You have every year between 200,000 and 400,000 Americans who die every year of medical errors. Many times this is because their medical history is not known of the provider who is going to diagnose and prescribe.
Right.
Having that information, write that on your phone, which you don't leave your house without, is a security and is a public safety tool. And CMS, HHS, and I think the White House had that conscious with this new 2.0 Blue Button policy and program to let the public know this is life-saving technology, you should be prepared.
Right.
And when the message is come across, then we are more likely to take action.
Well, Bettina, it's so exciting. We'll look forward to the launch in October. Good luck.
Thank you.
Lots of users, and the next time we can talk about exactly what has happened and how things have progressed. So congratulations on that. I'm Jessica DaMassa, here for HIMSS TV at Health 2.0. Thanks so much for joining us.